Hip preservation is a field, an emerging field in orthopedic surgery that provides a wide range of treatment options for young adults with hip pain. And they range from non-operative treatments, injections, hip-specific exercise activity, core-specific exercise and activity, all the way to surgery, hip arthroscopy or other surgical procedures. The range of patients that I see for hip problems are young adolescents from about age 16 to age 50. Some of them are athletes, a few of them are elite athletes. Some of them are individuals who are involved in jobs that have heavy lifting, very active occupations. And some of them are just regular recreational athletes who are trying to get a soccer game in with their kids. The common problems that I see in these young adults are hip labral tears, hip impingement, or as we call it, femoral acetabular impingement, as well as a variety of sports hip injuries that involve the tendons around the hip joint, for instance, the proximal hamstrings. These injuries are treated with hip arthroscopy for the hip labral tears and the femoral acetabular impingement. The other tendon ligament injuries around the hip joint can either be treated non-operatively or in a surgical fashion. When patients come to see me, I really offer them the full spectrum of treatments, including non-operative treatments. I think there is a great role for non-operative treatments, and I think a lot of patients get better without surgery, and we do offer them that. There's actually multiple non-operative treatments that we go through before we utilize surgery, so as a last resort to treat their hip pain. I did 2 fellowships in sports medicine, general knee and shoulder arthroscopy, and I did a 2nd fellowship in hip arthroscopy and preservation. With the great mentoring that I received from Yale, Stanford, and Hospital for Special Surgery, I really came out with a clear idea of what it is that I wanted to bring to the field, as well as tools and thought processes that will help me treat my patients. I absolutely love what I do. There's nothing else I would rather be doing than this. So it's a very fulfilling career for me, and it's a very satisfying occupation.